Hello, my name is Dr. Eli Whitney of the Heart and Vascular Institute of Texas. This is our educational program for patients like you who've experienced a heart attack. We're going to cover the cause of your heart attack and what we can do together to prevent complications from this event, and how to prevent future heart attacks. By working together, we can not only improve the length of your life, but also the quality of your life. Now let's take a look at the normal operation of your heart. Your heart is a muscular pump about twice the size of your fist and located right beneath your breastbone. The purpose of your heart is to pump blood constantly to your brain, arms, internal organs, and legs. Your heart must beat constantly to keep you alive. If your heart decided to take a vacation for just 5 minutes, you would die. Because your heart beats constantly, it needs a constant supply of blood and oxygen to perform its work. It is very similar to your car. If your car runs out of gasoline or air, it will stop working. In the same manner, if your heart runs out of blood and oxygen, it will stop working. Blood flows to your heart through two large arteries, the left main coronary artery and the right main coronary artery. These arteries are hollow tubes and are located on the surface of the heart. In a normal artery, there is plenty of space for blood to flow. This is a blocked artery, and the space for blood to flow is reduced. 9 times out of 10, the thing that causes the acute heart attack is when a blood clot is suddenly formed in an artery at the site of a cholesterol blockage. When this occurs, blood flow is totally stopped, and as a result, part of the heart muscle dies. The death of part of your heart is what we call a heart attack. Here, the blood clot formed in the bottom portion of this main artery feeding the heart. This is a small heart attack, and the person with this type of heart attack will survive and do well, since only a small part of the heart muscle died. This would be a large heart attack. A person with this type of heart attack would not survive. Since most of the time acute heart attacks are caused by blood clots, a very important therapy is aspirin. The best dose to prevent heart attacks is 160 milligrams per day, or 2 baby aspirin per day. This amount of aspirin has minimal effects on the stomach, but has been shown in several studies to reduce the risk of having a heart attack by 30 to 50%. If a person is allergic to aspirin, alternative medications can be used, such as ticlopidine or even the blood thinner Coumadin. Another important part of therapy is to prevent future cholesterol blockages from forming and even reversing the cholesterol blocking process. Everyone in the world is constantly putting cholesterol into the walls of the arteries and at the same time removing cholesterol. There are 3 types of cholesterol in the blood. LDL and VLDL cholesterol are the bad cholesterols, which are constantly being put into the walls of the arteries and blocking them up. The higher the LDL and VLDL cholesterol, the greater the risk of developing further cholesterol blockages. HDL cholesterol is the body's good cholesterol. This is the body's natural cholesterol removal system. The higher the HDL cholesterol, the greater the removal process. It is the balance between the bad LDL and VLDL cholesterols and the good HDL cholesterol that determines whether or not further blockages will occur or whether or not unblocking will occur. VLDL cholesterol is related to blood triglyceride levels. Triglycerides are another fat in the blood. The higher the triglyceride levels, the higher the VLDL cholesterol. All fats and oils such as butter, margarine, corn oil, and olive oil are actually made of triglycerides. By lowering triglyceride levels, you lower VLDL cholesterol and help improve cholesterol blockages. There are 6 possible major therapies which will improve the cholesterol balance in your arteries. Proper diet, exercise, weight loss, good control of diabetes, avoiding all use of tobacco products, and cholesterol-lowering medications. Let's first briefly cover nutritional therapy. The best diet is low in total cholesterol, low in total fat, particularly saturated fat, low in sugar, and high in fiber and complex carbohydrates. Simple nutritional changes such as replacing butter with soft margarine, replacing whole eggs with egg whites or egg beaters, drinking skim milk instead of low-fat milk or whole milk, eating non-fat cheeses instead of standard cheeses such as cheddar cheese, and cooking with corn oil instead of lard were shown to reduce the risk of heart attack by twofold within 5 to 8 years. This is covered in much more depth in our other video educational tapes on nutrition and clinical studies. These are available for your viewing. Weight loss is a natural result of a low-fat and low-sugar diet. Aerobic exercise therapy through formal cardiac rehabilitation programs has been shown in at least 6 separate studies to reduce the risk of dying after a heart attack by nearly twofold. The optimal amount of exercise is 2,000 kilocalories of exercise per week, which is equivalent to walking 20 miles per week. When you return home, we will recommend a graduated exercise program to build up your strength and endurance. It is important to start out slowly and build up your strength gradually. Weight loss is also a natural result of a regular aerobic exercise program. Stopping all use of tobacco products dramatically reduces the risk of death in patients who have had a heart attack. There is a 2 to 3-fold reduction in the risk of all causes of death in patients who have quit smoking after a heart attack. If you cannot quit smoking on your own, a formal stop smoking program using the nicotine patches and other nicotine replacement therapy can be a big help. If you want to participate in a formal program, let us know and we will get you enrolled. Good control of diabetes is very important since high blood sugar levels will cause bad cholesterol levels to increase and lower the good cholesterol levels. By controlling blood sugar, the balance between the good cholesterol and the bad cholesterol is improved. In the past 2 years, at least 4 new important therapies have become available to help control blood sugar. For more information, please view our diabetes education tape. The next subject is cholesterol-lowering medications. Over 30 studies show that cholesterol-lowering medications reduce the risk of having future heart attacks and strokes. Perhaps the most important study which demonstrates the value of lowering cholesterol was the 4S study. Patients were split into 2 groups. One group received simvastatin or Zocor, while the other group received a placebo. All patients were followed for slightly more than 5 years. The medication lowered LDL cholesterol 35% and notably increased HDL cholesterol by 8%. This is the first time a cholesterol-lowering medication was shown to reduce stroke. 256 deaths occurred in the group receiving the placebo compared to only 182 in the Zocor patients. Deaths due to heart disease occurred in 189 patients on the placebo compared with only 111 in the patients who received Zocor. Fatal and non-fatal heart attacks were reduced from 418 down to 279. All coronary events, including deaths, non-fatal heart attacks, bypass surgery, and balloon therapy, were reduced from 622 down to 431. The risk of stroke was also reduced by 30% in patients who received Zocor. In this study, there were 201 patients who had diabetes. In the next 5 years, the diabetics who received simvastatin or Zocor were 43% less likely to die from all causes and 55% less likely to suffer major coronary events such as heart attacks. For more information, please view our educational video entitled Diabetes and Heart Disease. In the CARE study, over 4,000 men and women with low cholesterol levels who survived a recent heart attack were split into 2 groups. Half received Pravachol, 40 milligrams per day, while the other half received a placebo. The average total cholesterol was only 209. After 4 years, the risk of having another heart attack was reduced by 19%. From these two studies, we know that all patients who have survived a heart attack should have their cholesterol lowered with cholesterol-lowering medications as well as diet. In the NIH CABBAGE study, medical researchers took over 1,300 men who had undergone previous bypass surgery and split them into two groups. One group was treated with lovastatin or Mevacor 40 to 80 milligrams per day to lower LDL levels below 100. The other group was given a much lower dose of lovastatin to reduce the LDL to less than 140. After 4 years, the number of repeat bypass operations and balloon therapies was 50% greater in the group that only had the LDL lowered to less than 140 compared with the group who had their LDL levels lowered to less than 100. For this reason, we currently recommend that all patients who have had a heart attack have their LDL cholesterol levels lowered to less than 100. We know from all of the previous studies, the more you lower LDL or bad cholesterol and the greater the increase in HDL or good cholesterol, the greater the protection against future heart attacks. Artery unblocking has recently been shown with very aggressive cholesterol-lowering therapy, exercise, and diet. Consider the following examples. This first patient had a very tight blockage in this artery and another moderate blockage in this artery. After 2 years of aggressive therapy with diet, exercise, and 3 cholesterol-lowering medications, you can see these blockages virtually disappeared. This is another patient who had a high-grade blockage here. This patient went on a very strict diet, lost 25 pounds, started exercising, and took 3 cholesterol-lowering medications. He reduced his cholesterol from over 250 down to 120. You can see the obvious improvement in the arteries that feed the heart. Again, no surgical therapy, just diet, exercise, and cholesterol-lowering medications. One of the common complications of a heart attack is congestive heart failure. When a heart attack occurs, a certain amount of heart muscle dies and is replaced by a scar. The remaining heart muscle from that time on must do the same amount of work that was done previously, even though less heart muscle is there to do the work. As a result of the increased stress, the remaining heart muscle can wear out and become weak. This causes congestive heart failure. Congestive heart failure typically develops 2 to 15 years after a heart attack, depending on the size of the initial heart attack. We can prevent or delay CHF by using medications called ACE inhibitors, such as captopril or enalapril. The use of ACE inhibitors after a heart attack has been shown to reduce the risk of dying by 25% in patients who have weak heart muscles after a heart attack. One of the tests you will receive after your heart attack will be a test to determine whether or not you will benefit from an ACE inhibitor. Sudden death is an unfortunate late complication of a heart attack. The risk of sudden death is reduced by 20 to 30% by the use of beta blockers in patients who have survived a heart attack. For this reason, most patients who have had a heart attack are routinely given beta blockers even if they feel normal after a heart attack to prevent sudden death. Small or mini electrical storms called ventricular tachycardia are sometimes seen in patients after a heart attack. When they occur within the first 48 hours after a heart attack, there is no increase in the risk of sudden death long term. However, when these mini electrical storms occur more than 48 hours after a heart attack, they are associated with a substantial increase in risk of sudden death. For this reason, most patients who have these mini or small electrical storms several days after a heart attack are studied by an expert in the electrical system of the heart to see if the risk of sudden death can be reduced by medications. At least 30 to 40% of patients become severely depressed after a heart attack for obvious reasons. Many studies have shown that depressed patients have a higher death rate after a heart attack than patients who are not depressed, and also suffer more frequent complications. The typical signs of depression are trouble sleeping or being sleepy all the time, change in appetite leading to weight gain or weight loss, loss of interest in normal work and social activities including sex, feeling guilty or being of little worth, lack of energy and fatigue. Many patients confuse the signs of depression with the side effects of certain medications. For this reason, many patients who are depressed after a heart attack stop many of their important medications, fail to exercise since they have no energy, do not make the important dietary changes, and continue to smoke. This is probably the biggest reason why depressed patients have a much higher death rate after a heart attack than patients who are not depressed. Fortunately, there are now several medications which can be used safely to relieve depression and improve mood. This will allow heart patients to make the important healthy changes they need to improve the length and quality of life. Examples of these medications are Prozac, Zoloft, and Paxil. Fortunately, the depression after a heart attack is temporary, and most patients can get back to normal within 6 to 12 months. Hence, medications are rarely needed long term. The return to normal sexual activity is an important part of the recovery from a heart attack. Normal sexual activity is no more strenuous or dangerous than walking up 2 flights of steps. The safety of normal sexual activity can be determined by a stress test. A stress test is a normal part of your post-heart attack evaluation. If you have not been able to return to normal sexual activity within 2 months of your heart attack, let us know. There are now very effective treatments for this problem. I hope this program has helped you understand the therapy for your heart attack. Working together, we can dramatically improve both the quality of your life and the length of your life.